Hello all, have a good day to all watching this video. In this video, I would like to give a brief description of common mental health issues, their common symptoms, and the common causes of mental health issues seen among people. Human beings are going through development in their lives. According to the APA Dictionary of Psychology, development is the progressive series of changes in structure, function, and behavior patterns that occur over the lifespan of a human being or other organism. All human beings go through different stages of development before and after birth. Prenatal development occurs before birth. After birth, human beings go through developmental stages like infancy, childhood, adolescence, adulthood, and old age. Through all these stages, several developments occur, including cognitive, emotional, physical, intellectual, social, moral, and so on. While going through different stages, individuals may deal with the different situations, interact with the different people, engage in different activities, etc. People's mental health may be affected by different factors during their lifetime. For instance, environmental factors, genetic factors, biological factors, and so on. If infants' needs were not met in their infancy period, there may be a chance to suffer from mental health issues. In infants, it is very difficult to find out their mental health issues. Common mental health issues seen during childhood are attention deficit hyperactivity disorder, autism spectrum disorder, and anxiety disorders. The major factors that may be involved in the development of childhood disorders include genetics and environmental factors. Attention deficit hyperactivity disorder, commonly called as ADHD, is one of the most common neurodevelopmental disorders in childhood. The three categories of symptoms of ADHD include the following. First one, inattention, difficulty in maintaining attention. Second one, impulsivity, often interrupts others. Third one, hyperactivity, seems to be in constant motion, runs or climbs at times with no apparent goal except motion. According to the Centers for Disease Control and Prevention, autism spectrum disorder, commonly known as ASD, is a developmental disability caused by differences in the brain. ASD is characterized by first one, deficits in social communication and interaction, and second one, restricted social interaction, repetitive behaviors, interest, and activities. Anxiety disorders involving separation anxiety are the most common anxiety disorders in children. Separation anxiety means a child worrying about not being with their parents or regular carer. Some common symptoms include feeling restless, being easily fatigued, having difficulty in concentrating, being irritable, having different aches, difficulty in controlling feelings of worry, and having sleep problems. The most common mental illness in adolescents are anxiety, mood, attention, and behavior disorders. Multiple factors affect mental health during adolescence, including exposure to adversity, peer pressure, stress, media influence, gender norms, the quality of their home life and relationship with the peers, violence, harsh parenting, severe socio-economic problems, trauma, chronic illness, and so on. Emotional disorders like depression and anxiety disorders found in adolescents share some of the same symptoms, including rapid and unexpected changes in mood. And these disorders affect school attendance and schoolwork. Depression can lead to suicide. Behavioral disorders include attention deficit hyperactivity disorder, characterized by difficulty paying attention, excessive activity, and acting without regard to consequences, and conduct disorder involving symptoms of destructive or challenging behavior occurs among adolescents. Eating disorders such as anorexia nervosa and bulimia nervosa commonly emerge during adolescence and are characterized by abnormal eating behavior and preoccupation with food, accompanied in most instances by concerns about body weight and shape. The most common mental health issues seen among adults are anxiety disorders, depression, and post-traumatic stress disorder. Anxiety disorders are characterized by underlying feelings of extreme fear or worry. Contained within this group of conditions are generalized anxiety disorder, panic disorder, social anxiety, and other phobia-based anxieties. Trauma, stress, personality, other mental health disorders, having blood relatives with an anxiety disorder, drug or alcohol use, etc. are the contributing factors in the development of anxiety disorders among adults. Depression is found among adults who experience a depressive episode that lasts for more than 2 weeks. A depressive episode can be exhibited through feelings of hopelessness, a general lack of energy, and thoughts of death and suicide. Major factors that lead to depression are medical conditions such as stroke or cancer, genes, stress, sleep problems, social isolation, loneliness, etc. Post-traumatic stress disorder in adults is caused by being exposed to trauma and is a irritable condition. Symptoms include experiencing vivid flashbacks of the traumatizing event, evidence of situations or places that may remind the individual of the event, or having trouble recalling the experience altogether. Combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, an accident, etc., can also cause post traumatic stress disorder among adults. According to the World Health Organization, dementia and depression are the most prevalent mental and neurological condition in the elderly population. Furthermore, anxiety disorders are found in the older population, followed by substance use problems at 1%. Dementia is a syndrome, usually of a chronic or progressive nature, in which there is a deterioration in memory, thinking, behavior, and the ability to perform everyday activities. Some of the causes of dementia include Alzheimer's disease that leads to various cognitive impairments, chronic high blood pressure, Parkinson's disease, and so on. Depression in the elderly, commonly referred to as a geriatric depression, can cause great suffering and lead to impaired functioning in daily life. The disorder may go undiagnosed and untreated because the symptoms occur in conjunction with other illnesses. Generalized anxiety disorder and specific phobias are the most prevalent anxiety disorders among older people. Anxiety disorder is characterized by a constant excessive worry about everyday events and issues that should not cause such severe uneasiness. Although it is normal for the elderly to worry about health problems and financial affairs, I hope all of you get a basic understanding about the most common mental health issues. Thank you.